Welcome to Shots for School Tdap requirement for 7th graders. This presentation will review the immunization requirement for a pertussis booster, or Tdap, for California students entering 7th grade. This presentation is available on the Shots for School website, located at www.shotsforschool.org. The Shots for School website is a detailed resource about school immunization requirements in California. The website will be mentioned often during this presentation. In this presentation, we'll briefly review pertussis disease and pertussis vaccines before discussing the Tdap requirement. Next, we'll talk about documenting the Tdap requirement, and finally, we'll explore how schools can plan for and implement the Tdap requirement. Pertussis, also known as whooping cough, is a serious bacterial respiratory infection that can last from weeks to months. The pertussis germ is very contagious and can easily spread to others at school or home by coughing or sneezing. During 2010, more cases of pertussis were reported in California than in any year since 1947. Unfortunately, pertussis remains a widespread threat to your students and your community. The good news is that immunization can help to prevent pertussis. There are two types of pertussis vaccines. The first vaccine, known as Tdap or Tdap, is given as a 5-dose series to infants and young children in the United States and many other countries. The Tdap vaccine is effective at preventing pertussis, but its protection wears off over time, leaving middle school students and older persons vulnerable to catching and spreading pertussis. To help stay protected, the Tdap or Tdap booster vaccine has been recommended for all adolescents and adults in the United States since 2006. Many children get a Tdap booster during their routine checkup at about age 11. The abbreviations of the pertussis vaccines are very similar, which makes it easy to get them confused, even if you're familiar with them. As a reminder, the Tdap vaccine is the booster given at age 7 or older, but more typically after age 10. In contrast, the Tdap vaccine is given to children younger than 7. To make things even more confusing, there is another older tetanus booster vaccine called Td, which does not protect against pertussis. It will be helpful for you and your colleagues to review the differences between these vaccine names to assist with checking student immunization records and answering questions from students' families. Now let's review California's Tdap requirement. In late 2010, California enacted Assembly Bill or AB 354, a new law that required all students entering or advancing into 7th through 12th grades in 2011 to have met the Tdap requirement before starting school. The law led to the largest student immunization campaign in California history, affecting more than 3 million students in the 2011-2012 school year. Because of the large scale and short implementation time for the new law, in the summer of 2011, the legislature and the governor granted the schools the option of having a brief extension period for students to comply with the Tdap requirement. The extension or grace period was granted only for the fall of 2011 and not for future years. Now let's compare the current situation for the Tdap requirement. In the 2012-2013 school year, and each year thereafter, students entering or advancing into the 7th grade will need proof of having met the Tdap requirement before starting school. Most 8th through 12th graders in California should have already met the Tdap requirement. However, the small percentage of students transferring to California from a different state or country need to provide proof of having met all current California immunization requirements, including the Tdap requirement. Similar to other California student immunization requirements, students are to be excluded from school until they have met the Tdap requirement. The Tdap requirement applies to public and private schools. The Tdap requirement now affects about 500,000 students each year. As you prepare for the upcoming school year, it's important to recognize that many students haven't had a dose of Tdap yet, but many have. Families will need to check their records closely, contacting their medical care providers as needed to determine whether their children have had the Tdap booster or still need to receive it. As of March 2012, there has been no extension period granted for the ongoing Tdap requirement. All students will need to meet the requirement by the first day of school. Please note that the California legislature and governor can change California's laws at any time. The shotsforschool.org website lists the current status of California school immunization laws. To repeat, as of March 2012, there is no extension or grace period to allow students to attend classes without meeting the Tdap requirement. Strictly speaking, the law requires students to have one dose of pertussis vaccine given on or after the 7th birthday. Most of the time, Tdap is given to children on or after the 10th birthday, but any dose of pertussis vaccine given on or after the 7th birthday meets the requirement. In contrast, the following do not meet the Tdap requirement. Any dose of the TD vaccine, that's the tetanus booster that does not protect against pertussis. Similarly, having had pertussis disease recently or long ago does not meet the Tdap requirement. Note that students are able to receive a dose of the Tdap vaccine even if they have recently received a dose of the TD vaccine or are pregnant. This section addresses how schools document the Tdap vaccine requirement. Schools are being provided with sheets of adhesive stickers to document the Tdap requirement. The sticker contains spaces for recording the date of the Tdap immunization, the student's birth date, check boxes that describe how the student has met the Tdap requirement, school staff name, the date that the staff member is recording the information, and the student's name or ID number. The sticker should be placed in the upper corner of the Blue California School Immunization Record, also known as the Blue Card. You may wish to prepare Blue Cards with a blank sticker ahead of time, or you may prefer to fill out the sticker before placing it on the Blue Card. Either method is allowed. The completed Blue Card with the completed Tdap sticker information should be filed with the student's permanent records. You will need to review the record in the future for reporting and when there are cases of pertussis in your school or community. If you need more Tdap stickers or Blue Cards, contact your local health department or school district. Here is one example of recording information onto the Tdap sticker for the Blue Card. In this case, a student's record shows being vaccinated with the Tdap on November 6, 2008. The information has then been transcribed from the student's record onto the Tdap sticker. The school staff member has reviewed the record, marked the checkbox indicating that the student received a dose of Tdap on or after the 7th birthday, filled out the remainder of the information on the sticker, and affixed the sticker to the upper corner of the Blue Card. In this example, the family has brought a yellow card immunization record to school, but other options are acceptable. The family may provide any type of form for the immunization record as long as it clearly indicates the student's name and birth date, what type of immunization was given, the date it was given, and the name of the physician or agency who gave the vaccine. As you are well aware, it is important that the records are complete, clear, and easy to read. In contrast, here are examples of records brought in by students that are difficult to understand. In both cases, the family has diligently kept the yellow card immunization record since early childhood, from a time when the Tdap vaccine didn't exist. So when the students were immunized in 2009, their old yellow card records did not include a box for the Tdap booster. You can't tell from these records which vaccine was given. Was it the Tdap vaccine, which satisfies the school requirement? Or was it the TD vaccine, which does not meet the requirement? In such cases, the school needs additional information from the doctor's office to answer this important question. To help solve the problem of confusing records, the flyer shown on your screen is available on the Shots for School website for you to share with your local healthcare providers. The flyer directs providers to give clear documentation about the Tdap immunization to help families and schools. There are different types of Tdap records that can provide clear information for schools. Let's review some examples. The California Immunization Registry, or CARE, is used by many healthcare providers and schools throughout the state. Hundreds of thousands, but not all, students in California have their immunizations recorded in CARE. When a student has a dose of Tdap entered in CARE, CARE can print out a blue card regarding the student that already includes the Tdap sticker information in the upper corner, saving you the work of filling out and attaching the Tdap sticker. If you're interested in learning more about CARE, please contact the CARE Help Desk at the phone number or email address listed on your screen. A school information system, or SIS, is software used by schools for many important functions, including student health documentation. Similar to the California Immunization Registry, some SISs available in California are capable of printing out a blue card with Tdap sticker information, while others do not have this capability. For further information, please check with your SIS vendor on whether or not it prints a blue card with Tdap information similar to CARE. Here is another option for healthcare providers to document Tdap immunization. A clearly written mail merge letter that contains all required information, including the student's name, the date and type of immunization, and the provider who gave the vaccine. Several large medical organizations in California already use such letters. The Shots for School website has sample forms and letters that help healthcare providers give you clear documentation. You are welcome to share these with local healthcare providers. California law allows two types of exemptions from the Tdap requirement. The first is an exemption for children who have a medical reason to avoid the Tdap vaccine. Such conditions are very rare, and medical exemptions require documentation from a licensed physician. The other type of exemption that is allowed is a personal beliefs exemption. A parent seeking an exemption because of his or her beliefs needs to document this for the school. This exemption is intended for families with beliefs against immunizations, but is not intended to be used out of convenience or in case of procrastination. On your screen is an image of a form available from the California Department of Public Health for parents seeking exemptions based on personal beliefs. For additional copies of the form, please contact your local health department or school district. It is important for parents to know the consequences of immunization exemptions on the health and education of their children. Students who have medical or personal belief exemptions may be excluded from school for weeks after exposure to pertussis at school or in the community. Now we're ready to discuss how schools can plan for and implement the Tdap requirement. In late 2011, the California Department of Public Health received responses to a survey from more than 1,500 schools about their initial efforts to meet the challenging Tdap requirement. When asked what would work well and what would help in future years, your colleagues at California schools gave the following recommendations. Start early, using as much lead time as possible. Communicate frequently to families about the Tdap requirement. Persistence and hard work are necessary to communicate and follow up with families and students. The California Immunization Registry can be a helpful time saver, as can school immunization systems that include a Tdap blue card option. Clear records from providers will help avoid dealing with confusing immunization records that are hard to read or that don't distinguish Tdap from TD. Organization, teamwork, and support from administration make a big difference. Use the materials available on the Shots for School website to help you. Schools also noted the benefits of working with local partners, including local vaccine providers such as pediatricians, family physicians, medical groups, community health centers, and others. The local health department. The County Office of Education. local feeder schools that instruct 6th graders if your school does not include 6th grade, other partners such as local service organizations. One benefit of these partnerships is to help you identify places where students can get immunized if they don't have regular medical providers. Remind families frequently about the following messages. Has your child received a Tdap booster yet? If not, make an appointment to get the Tdap booster and other recommended adolescent care as soon as possible. Appointment slots fill up quickly, especially in the weeks before school starts. Once the booster has been given, get a record of the Tdap booster from the healthcare provider. Bring the Tdap immunization record to school as soon as possible. It's important to provide information about the Tdap requirement repeatedly in a variety of ways, including messages and electronic banners available at shotsforschool.org that you can include on your school website, emails, newsletters, telephone calls, and automated call systems. Your school's marquee or billboard where you can display messages throughout the year, especially during summer vacation. Informing families during parent conferences, back-to-school night, open houses, on report cards, in registration packages, or in other notices. Using the student newspaper, newsletter, videos, podcasts, posters, stickers, or banners in the school hallways. Working with your local PTA and other community service partners in your communications. Contacting your local media. Schools continue to use a number of creative alternatives to get the word out. It's important that schools develop their record systems and begin collecting records as soon as possible to reduce the back-to-school rush and even out the workload. Repeatedly instruct parents about how and when to submit Tdap records. Let families know how to submit records during summer vacation when school staff may be away. It's important to plan for the back-to-school rush. How can you reduce the number of students arriving on the first day without complete immunization records? Possible solutions include ongoing communications, including reminding the families about the risk of exclusion compared to the benefits of immunization with Tdap, working with health departments to identify local resources for immunization and directing students to them. Consider incentive programs. Some schools, on their own or with partners, have used incentives to reward students who get records in on a timely basis. Incentives may not be possible in all settings. Will your school need additional staffing before and after school starts? How will you collect and review immunization records? Will there be records that have arrived during the summer that need review before school starts? Finally, how will you handle students who haven't met the Tdap requirement once school starts? Plan your procedures ahead of time. Each fall, schools with 7th graders are required to report a brief summary of the immunization and exemption status of their students. This is similar to the long-standing reporting requirement for California schools with kindergartners. For additional information and instructions, please visit www.shotsforschool.org, where schools also may submit their reporting data electronically. Once again, for a variety of resources to support schools with their student immunization requirements, go to www.shotsforschool.org. Once you're at the Shots for School website, click on the Tools for School page for information and materials for schools. We welcome your questions and comments. Many questions have been asked by other schools and answered in the frequently asked questions posted at the Shots for School website. If your question hasn't been answered, please contact your local health department or email your questions and suggestions to the email address on your screen. In closing, thank you and your colleagues for your diligent efforts to protect the health of your students through this important, if challenging, immunization requirement. Let us know how we can help you.